What if your child were severely injured in an accident? What if an infant in your family were born with a life-threatening condition? What if your child's best friend needed an emergency transplant? Well, the fact is, these things happen to someone's child every 6 seconds. It's the moment we all fear. Hi, I'm Ileana Bravo. As a journalist, I've had to cover these kinds of situations time and again. When a medical emergency or severe illness strikes a child, every parent wants the best treatment available. That means the Holtz Center for Maternal and Child Health at the University of Miami Jackson Memorial Medical Center. Rated overall as one of America's best children's hospitals by U.S. News and World Report, the Holtz Center is a leader in the development of life-saving technology, impacting families throughout the hemisphere.
When this doctor was able to say, Jackson Memorial, that's where I would take my son if it were me. We got on the road and came straight here, and if it weren't for Jackson Memorial, I don't know what we would have done.
Many of these children who had, just a few years ago, no curative options are now cured, living happily ever after. Community support, altruistic support is an essential piece of putting that puzzle together so that you can save a life.
Each year, 50,000 critically ill and seriously injured children receive treatment at the UM Jackson Memorial Medical Center. Another 8,000 infants are born here, some with life-threatening conditions. But these numbers, more than 50,000 children per year, push the facilities to the limits.
We have a 10-bed unit, and we are frequently running over 10 beds, which means that we have to take a room off of one of our adolescent floors or one of our infant toddler floors. We're cramming equipment in there where it becomes hot in there. It's not the best, but it's all we have.
Overcrowded areas and disheartening surroundings don't give children the positive environment they need and deserve for optimum healing.
Definitely the pediatric intensive care unit is the prime example. The difference between that unit and most adult units is that it has all the kids that are ill, seriously ill, in it at one time or another. So that unit has to grow. It doesn't have any family waiting space. I've seen families in the hall being told that their child may not make it in the hall with other people watching and walking around. I can't say there's anything sadder or more depressing than that.
The Jackson Memorial Foundation is striving to create the finest pediatric facility in the country. They already have some of the most skilled physicians, leading-edge medical technology, and life-saving techniques. What's missing? Medical facilities that would allow the medical staff to impact our children's lives to their greatest potential.
It's a big job, and I think it takes an entire staff of people, of all the various healthcare providers, as well as community people. All of us together form a team to treat any one of these children. It cannot be one individual alone.
The situation is critical. At present, Jackson simply cannot accommodate all the children who need critical care. The space just isn't there. One of those children could be yours. So now it's time to create new miracles. The Holtz Center must house a new pediatric intensive care unit, a cardiovascular unit, a pediatric emergency room, and over 8 other areas of specialty care.
This is when people that can make this happen gotta pitch in. If you don't do that, then we can never have a good facility that we were going to be proud of in this community. We need the best that we can offer.
Could you say no to a child in pain? A child whose very future hangs on the accessibility of life-saving technology?
We owe something to Jackson. Jackson was very important to our lives, and it's time to pay back.
When we have healthy children, we have a healthy community.